Hey, good evening, everybody.
Hi.
We just dropped Amber off at the Sitters, and we are headed out of town to Gainesville, to the University of Florida Medical Center. So, Julie has told you in the last month, I guess, off and on in the vlogs, that she's had some major oral surgery, and we thought, since what we're going to be doing tomorrow is kind of getting her inundated as a new patient up there for future treatment, that we would kind of take you on the journey and let you know a little bit more in detail about what she's been dealing with this last several weeks.
This is going to be the vlog where I tell you everything about what's going on with my mouth. So,
come on.
2 hours, 45 minutes.
2 hours and 45.
Let's go to Gainesville.
Let's go. Okay, so it's about 7 o'clock. We made it into town. I think we're 3 miles from campus, which is where we'll be tomorrow morning. It wasn't a hard drive, but I think we're kind of beat, aren't we?
Yeah, we were driving into the sun most of the way, so
yeah,
it was a little bit tough.
My eyes are a little fatigued, but
keep your fingers crossed.
Yes.
I'm hoping for good news tomorrow.
I think we'll have good news tomorrow.
The appointment's at 10:30, but I have to be there 30 minutes early.
You got all your
hopefully we're
work
close by.
filled out, all your paperwork?
I got my paperwork filled out. Should be ready to go. I got my CDs, I got everything. So I think tomorrow, if editing Julie, cut this out. If I get caffeinated, I will sit down and talk to the camera about my experience so far, leading up to why we're here. But there's a lot of images that I can't even bring myself to look at because they bother me so much. And I'm going to have editing Michael lay those images down while I'm speaking. He could probably explain to you in more detail the medical things behind what's going on, but I'll try to make it quick and not talk too much. But I can't look at the pictures, so that's what he's going to contribute to this vlog. Good morning, everybody. Let's enjoy some hotel coffee, shall we? They had a decaf, a light roast, and a tea. So this is the light roast coffee, just black. Way too hot to drink quite yet. I guess I don't even know where to look. I have you propped up on a trash can on a nightstand, and the lighting's terrible. And I apologize about my hair because I forgot to bring a hairbrush. But it's about 5:30 in the morning. Michael's at the gym. And I got up because I knew I needed to do a sit down and talk video, and I have no idea how long this is going to take. So as far as my oral situation, I've always had a droop on the left side of my mouth. So this is not new. It all started for me back in January when I went to a dentist here in Florida, and just to get a regular teeth cleaning. I've always taken excellent care of my teeth. I've never had any problems with my teeth. And when she did her x-ray, she found a very large spot right here on the x-ray that was just black. And like there should have been a bone, but there was just this big black void. And she refused to clean my teeth. I thought she was crazy, and I went to get a second opinion, but turns out her x-ray was accurate. And there was something weird going on with my teeth, and the dentist said that it is beyond their scope. They can't do anything about that. The theory that both dentists had was that one of my front teeth was dying and I needed a root canal. So I did go to an endodontist, and they did a bunch of tests on my front teeth. Like I said, I've always had healthy teeth and taken care of my teeth. They did some tests on my front teeth, and they did a 3D image, and they said that no, none of the teeth are dead. There's no reason to do a root canal and I guess kill a healthy tooth. They said I needed to be referred to an oral surgeon. So that's how this was all, by this point, middle of February. So I got an appointment for an oral surgeon. I went to her office and I had a 3D image taken in her office. And she came back and said, she showed me the image first, just this gaping hole here, which she explained to me was a cyst, but she didn't know why I had it, but it was kind of like emergent, because it had tunneled its way almost completely through my jawbone, almost all the way to my tongue, and had eaten away a lot of my jawbone. She said she sees maybe 3 of these cases a year. They're almost exclusively occurring in children. So it was unclear why this was happening to me. She said sometimes it can happen as a result of blood disorders, which I don't have. We've already tested all of that. She said sometimes it can be a cancer. We tested, it sent it off. It isn't that. So we're not really sure why we have this thing. However, at her office that very first day when she told me that I had the granuloma, she said basically this is so emergent, we need to do surgery today. But you're welcome to go get another opinion from somebody else before we do this surgery, but it's going to be kind of major. I had already kind of thought that it was probably a cyst, just from the research that I had done on my own, and one of the dentists had told me that was her best guess what it was. I was pretty sure that it was a cyst, and I had tried calling the rounds of oral surgeons before I made the appointment with this surgeon, and most of them couldn't see me for weeks or months, so I just decided, let's go ahead, let's do the surgery right here today. She said it would take about 20 minutes, but it took about 45. And the surgery wasn't fun. It wasn't painful, but she gave me so much lidocaine so that it wouldn't be painful. But she had to scrape. It felt like a wine cork sized granuloma is what we're calling it now, out of my jawbone. The bone had been eaten away so much that it was actually spongy, and she had to scoop a lot of it out. She had to put in a bone graft, about a quarter size cadaver bone. She had to kind of patch the hole with, which she said could take as much as 8 months to fuse. Yeah, the surgery was kind of a nightmare, but she did an excellent, wonderful, she did an amazing job. She worked so hard trying to scrape every last piece of it out. And she kept quite a bit of it, it looked like, to send off to the University of Gainesville for pathology testing, which we got those results back pretty quick. I think her first concern was that it was a tumor or some type of cancer, which she visually, by looking at it, she said, I'm 99% sure that's not what it is, but there's no point in taking any risks. Let's make sure it's not that. So she sent that off. I went home to recover from the surgery. I have been back in her office that first week, 2 times that first week, 2 times the second week, and every single week since, because she said she wants to watch me like a hawk. The swelling was incredible. The pain was insane. But I got through the post-op period. That was fine. Sorry, this is a little hard to talk about. The issue became when the pathology results did come back and she was able to diagnose exactly what it is. I believe she called it it's a granuloma, but it's like a marsupialized granuloma. The word she used reminded me of a kangaroo, like a marsupialization or something like that. And it has a 70% chance of recurring over and over and over for the rest of my life. Unsure why. She said her first guess was that maybe I had trauma to the face and one of my teeth was overproducing T cells or stem cells. But she doesn't think that's the case now. She doesn't know why this is happening. So I have been referred to the University of Gainesville because this is a bit above her head, probably above the head of anybody in Melbourne. And she knows that since there's a 70% chance that I'll have to have surgery again, I need to go ahead and meet these people, have a consultation, do imaging with them, and basically be on standby so that if I ever need this operation again, I can just come up here and they can do it. And apparently they have either lasers or robots or something a little bit more high tech than we have in Melbourne. So that's why we're here. My appointment is at 10:30 this morning. I have to be there 30 minutes early though. Um, the other issue, she gave me quite an incision, of course, to do this surgery and stitched it up. 10 days later, I was one of my regular bi-weekly appointments, and she took the stitches out, but there was a little hole. It's about the size of a very dull pencil that had not healed. Now, all of this time since the surgery, I had been on a liquid diet, and she's like, don't worry, it's a soft diet or a liquid diet. She said you can eat things like ice cream, yogurt, and tapioca, and applesauce, and these are all things I don't eat, I don't like, I would never eat. So I was expecting when she took those stitches out that I was going to finally be able to chew, but because the hole had not healed, she gave me a prescription for antibiotics and a special rinse for it, and she said to rinse it 2 or 3 times a day, keep it clean, continue your soft diet, and we'll check you out again. And I forget if it was 3 days, 5 days a week, something. I went back, continued everything just like she told me to do, and I went back some days later, 5 days, whatever, and it still hadn't healed. So she's like, well, okay, we just need to restitch it. So she put stitches back in my mouth, which is not comfortable, but it's fine. Left the stitches in for the length of time they had to be left in, which I think was a week maybe. But this is all going back to February now. It's getting blurry. When she took the stitches out, the hole had not healed at all. And we're a little discouraged by that fact that it hasn't healed, because she said chances are the reason it hasn't healed is because the granuloma is trying to grow back and your body is trying to leave a pathway for it to expel anything that maybe were to build up. But I've been flushing it just as she told me to. Nothing is coming out. I've been keeping it clean, doing all of the oral care. I did a soft diet for 2 solid months. The only time I ate anything was on Easter, and I cut my food into such tiny pieces I was basically swallowing them whole. 2 months I did a soft diet. But as you guys probably know, I'm carnivore. I do not eat any of the things that she told me I could eat. So it was a real struggle. Breakfast every day for 2 months straight was boiled bone broth with eggs that I poached, and I poached them so loosely and whipped them up so they were liquid. Poached eggs and bone broth, and I made a soup. I just kept the broth and made a soup out of it. I ate that every day for breakfast for 2 months. Dinner was one of 2 things. Michael blends up grounded chicken and puts it together with some sour cream and some other ingredients and makes this completely soupy chicken soup. It's delicious. Or I would completely mash up an avocado like baby food and put it in a bowl, and then heat up a bowl of like Mexican crema or queso and mix the 2 together. So it was kind of like a guac and queso minus the chips. I ate those 3 meals every single day for 2 months because I was trying to, do everything I could do to not cause any injury or damage to this area. But the hole still has not healed, and it's now been, God, we're in May. So anyway, that's the story. Michael has all the pictures. It's hard enough for me to even talk about this. I can't look at the pictures. So he's going to go back and either drop the pictures in here as I'm talking, or he's going to play them next and do a voiceover. But anyway, I'm going to just drink this hotel coffee here and get ready and just chill in the hotel while we wait on my appointment, and then we will check back in and let you know how things are going. I know this isn't one of our more fun videos, but I'm hoping that, since this is such a weird thing that happened to me, that we'll get more answers today, but perhaps there is anybody else out there who's going through something similar. Just so you know, it was almost like I had a wine cork sitting right here in my jaw that I couldn't see either from externally. I couldn't feel it. It was painless. Didn't affect my chewing. I was completely unaware that I have it, have no idea how long that I had it. And then after it was pointed out to me, if I actually pulled my lip out and looked inside my mouth, I could see it. It looked like a dark purple marble and a swelling, almost like a little wine cork. All right, I think that I have given you the story. Sorry it isn't a fun or funny one, but after we get some more answers today, I will hop back on here and we will continue this video and let you know what's going on. See you in a bit. All right, it's about noon. I'm a little traumatized by the conversation that we just had, although the University of Florida seems to be a fantastic place, and I really respect and trust what the doctors are telling me. But I'm going to let Michael be the one to interpret everything that we were just told, but I'm going to wait till we get back home so you don't have to listen to us.
Yeah.
Talking on the highway in this soft top Jeep. I'll have Michael check in with you when we get home, but
I'll check in a couple hours.
I don't think I'm emotionally going to be able to talk about this anytime soon.
Oh, let me sit down here. Hey guys. So good morning. This is the next day from our vlog. So we came home last night and had a lot to kind of process and go over and things to talk about. And so I'm upstairs in the office doing kind of an update to let you know in more detail what went on, simply because Julie didn't think she would be able to do it. And so I wanted to kind of talk away and go through the details with you without having her in the same room. We thought yesterday was going to be more or less a new patient intake and just simply a way to get to know Julie in case the time ever came that we had to receive care from a large academic medical center. And while we knew that the most extreme case was going to be this resection of the jaw, and you can look that up, we were trying to avoid that at all costs. And that's actually the exact words that our surgeon here in Melbourne had said as well. Our oral surgeon here was educated by the guy that we saw yesterday at the University of Florida. And while I think that they were great, and I do believe they are well respected, and I would respect his decision if it ever comes to that, we are not going to seek what he is recommending for right now. And what he is recommending is a complete resection of the jaw. So while I'm talking through this, editing Michael is going to show you some photos of the before surgery. And I'm going to read you a little bit from the pathology report, because we did have this sent off to the University of Florida when Julie initially had this, simply because no one knew what it was. And there's always a there's always a chance that it could be some sort of cancerous tumor. And so we wanted to make sure that hopefully that wasn't the case, and it's not. It's a completely benign cyst. However, it has marsupilated. And so just like in the animal kingdom, when you think about something that has a pouch, that's exactly what this cyst has done. So this odontal cyst has come into the mandible, to her lower jaw, and actually created a pouch to where you're looking at stem cells that were created when she was in the embryo. It wasn't anything that she did. We were told that very clearly yesterday, or hasn't done. It hasn't dealt with anything of her childhood or her parents' lineage or her grandparents. This is no DNA link either. It is something that is random, that when she was going through the developmental process in the womb, it had, at the time, knew that it would turn on, so to speak, that these switches would become activated at some point during her life. And so, well, if we read really quickly, this cyst, when it was sent off to pathology, the report says, that this was done in a matter of months. So that means that it is very quick to grow and divide. And essentially, this granuloma, right? That's what we would classify it as, is simply an inflammatory response from Julie's own immune cells that is causing this growth. The problem is, what it's doing by creating that immune response is that it is taking bone tissue and softening it into glandular tissue. And so it's eating the bone. And that's where we have to have that stop. And so here, I'll go through this first and then explain what the doc said he wanted to do yesterday. So we've got a benign cyst, which tends to exhibit an aggressive clinical behavior and a high rate of recurrence. And that's another big issue because she's already had it scraped away, cleaned out once, and had to have a bone graft about the size of a quarter placed. Now that is supposed to take roughly 8 months to heal completely. So we're still well outside that window. However, during his examination yesterday, remember we still have a small hole from a spot that was in between 2 stitches that has yet to heal. And it's about the size of the tip of your ink pen, but he was pushing in that area yesterday on her lower jaw, right at the incision point, and saw a little bit of not frank pus from infection, but a result of dead white blood cells. So in his mind, that means that it could be that we're fighting off the bone graft. It could be that we're simply trying to mend and heal the bone graft, or it could be that the bone graft is dead and didn't take. And that means, ultimately, that our oral surgeon did not get all of the glandular cyst the first time. And she said she thought she did. She said she tried her best, and I'm sure she did. But it's very difficult without literally having a microscope to see what the edges of this glandular cyst are, to be able to make sure that you get 100% of those cells. And any that are left are going to begin to divide. And so the recurrence is upwards of 70%. And taking all that knowledge into the office yesterday, the doctor said, look, as young as you are, we want to take an aggressive approach. And the aggressive approach is going to be a minimum of 4, but we think 5 teeth. So go right down in front, start with your left incisor and count over. A minimum of 4, but potentially 5 teeth that need to be removed. So they will do a cross section where they will cut away that much of her lower jaw along with the teeth and remove it. That's going to be outpatient surgery. That is supposed to take roughly 6 to 8 weeks to heal. What they will do is put what they call an antibiotic spacer in between that gap of the bone that they cut away. Allow that bone to heal on the edges, make sure that we prevent any infection. If it looks like it's healed after those couple of months, then we will have to go back in for a second surgery where they will do 2 things. They will bone graft. They want to bone graft from Julie's hip. So if you reach down and you feel the pointiest part of one of those hips, that's called the iliac crest. So he said he would make about a 2-inch to 2.5-inch incision, shave down some of that iliac crest, come up under and cut underneath her chin, and actually remove that antibiotic spacer that way and insert the bone graft and close that up. That would again be about another 2.5 incision. He says he could hide it. He is an oromaxillary, so he has had some plastics experience, some plastic surgery experience. So he said he would hide that scar. We would go back home at that point, again, recuperate for about 2 months. If that heals and everything looks okay, she would go back in a third time for what they call a social, not a retainer. What was the word he used? Partial. A partial. So think about the false teeth aspect. It would go in like a retainer as far as metal to stabilize, but it would be those missing teeth. However, the social aspect of it means she could wear it out. She can smile in photos, but she cannot use it functionally to eat. And so that would have to be removed every time that she would eat, whether in public or in private. That stays in for another 6 to 8 weeks, allowing the bone, that understructure, to heal completely. And then after about 4 or 5-ish, whatever the timeline is, months of downtime, then we would be looking at starting the process of implants. So that bone has to be dense enough and has to be structurally sound enough to be able to have a drill down into that bone, the new bone, remember, and have the pegs started for the implants. So he said if you add all that up, we're looking roughly at a timeline of 8 to 12 months minimum, where she would be back to, I guess we would say, somewhat of normal function all the way around. So that would include the that would include the implants of the teeth. So that was a lot to think about. And that was a lot to emotionally prepare for, certainly for Julie, as well as myself. And so we talked a lot on the 2-hour and 52 or 54 minute drive back to Melbourne from Gainesville. I've been doing a little bit of researching. Again, it is extremely rare. You take a big teaching institution only seeing these 4 a year. But I think personally that there are other therapies and treatments available before we just go in and resect that jaw. We're not saying that's out of the realm of possibility, but I think we are confidently saying that's out of the realm of the possibilities for now. And so I found a few different things just kind of initially, right? It's not even been 24 hours yet, but I've found a few things that I would like to talk to our surgeon with on Friday, which is when we're going back to see her here locally. Julie will have a 3D scan at that point in time. We're not sure what it will really exhibit. Nobody really wanted to scan her this early because they said you're not really going to see a whole lot of structural change because the bone graft takes so many weeks to actually fully heal and reattach itself and have your body kind of calm itself down from, resorbing some of this bone tissue. However, we told her, look, we thought University of Florida was going to scan her. Our surgeon thought the University of Florida was going to scan her, and they haven't. So now that we are, let's look at our dates here. Oh gosh, what date was this? I don't even see a date at the top of this. February, I think it was February 28th was when she had the surgery. I think that's right. So we're talking now several weeks. We want to see nothing else but whether or not someone can tell us, has this started to return? And I don't even know, and she doesn't know, the surgeon doesn't know whether or not we can see that, but we want the image anyway. At least at that point, we'll be able to say, hey, does this look like a normal healing process from what you've seen? Or does it look nothing like it? It's the bone being eaten away again. Or is there anything that you can tell? What can you kind of So we're going to try to, interpret, infer, whatever you want to say, as much possible information as we can from the scan and kind of move from there. I've also initially seen different types of medications. Remember, this is an anti-inflammatory immune response. So there are pharmaceuticals that can drop that and slow that, of course, when you think about the various diseases that you see on everyday commercials used to treat autoimmune diseases. However, I've also seen some therapies on different frequencies of wavelength that have also been shown to kind of help define those margins of, okay, if this is a cyst, how do we make sure that we can kind of concentrate and kill the cells that are proliferating without destroying any of that surrounding tissue, but also make sure that it doesn't recur. And so that's what we're trying to start to look up to make sure that we have some sort of conversation starters whenever we head to see this little lady in a few days. And so I think the couple of things that we took away, again, and I think I said this yesterday, so I apologize if I'm repeating myself, but she can eat again as long as she's cutting her food. That includes anything that you're not using, you're not incising, you're not using those incisors for. So we still can't pull away from the mouth, but head under the water, swimming, snorkeling, scuba. So that was of course, that's what Julie loves. She loves the water. So it coming, late spring into summer, that was a big deal. So, I guess we accomplished that, and we accomplished becoming a patient and establishing a relationship with the folks at the University of Florida. But we are not going to stop and just take this first recommendation for treatment. We are going to follow up with our surgeon here. We are also going to make contact with our previous dentists and surgeons in the Charlotte area. And I'm going to also start looking outside of, this region and open it up to all of North America as well as Europe, because I just feel like we have a lot more intuitive ways to treat these glandular cysts than just opening Julie up and cutting away her jaw. And we're gonna exhaust those options before we worry about anything as severe as cutting away a significant portion of lower jaw. So regardless, of that fact, he said it would be outpatient surgery. I'm not sure if I said that before. That doesn't matter. It's severe enough that's going to require general anesthesia. It's going to require multiple surgeries, multiple surgeons, and reconstruction of that jaw. And so we would rather continue to research and use our knowledge in the healthcare industry to look for other ways, innovative ways, maybe ways that haven't really been looked at or studied in this country, elsewhere, to see what is possible, what can we do to prevent having this cutaway. So that's my update. I've rambled on for 17 minutes, so I apologize for that. But that's what we're looking at. We're looking at, I can see it here, a measurement of 2 by 2 by 0.6 by 0.4 centimeters. So you're edging up onto a full inch of that glandular cyst. And when you're talking about a small area, like this anterior portion of the lower jaw, that's a lot. Okay, and that was, and like I said, the bone graft was about the size of a quarter. So that's what we overlaid to try to get that to heal properly. So it's encouraging. No fever, no swelling in that area. The follow-up is supposed to be at the end of May to receive another image and kind of make a plan from there. And we're going to stick with that for the time being. But we're going to go see our little lady on Friday and have another conversation and have an image and kind of compare the before and afters, because we don't have an after image yet. And then talk about what should we, and then what could we, and then what will we expect to see in the next coming weeks and months. So that's my check-in with you. We'll see you again shortly. Thanks for joining.